Hey, welcome. I'm Dr. Ruth Roberts, the original holistic pet health coach, and with me today is Dr. Betsy Redmond. For those of you that don't know her, she's worked in a clinical laboratory and research setting for almost 20 years. She holds a master's of medical science from Emory University, a Ph.D. in nutrition from University of Georgia, and her research has included evaluating the impact of diet on human health and how to target education to make changes that improve laboratory values. So that's a novel concept to actually educate folks to do the right things so that their health improves. So she did all this on the human side. And in her professional work, she was the member of the team that actually brought the very first gut microbiome PCR test to market and has researched how to apply metabolomics, which is the study of metabolites, in clinical practice and the differences in those things across species. So Dr. Betsy figured that pets needed quite a bit of help. So as the co-founder of Innovative Pet Lab, Betsy's goal has been to provide easy to use testing that gives pet parents a deeper understanding of their pet's overall health and actionable steps they can take. Dr. Redmond lives in Atlanta, enjoys spending time with her husband, three kids, and their two dogs, Ollie and Linda. And she also enjoys running and can never get enough of researching to get the right answer. And I think that's really critical. So, welcome. So glad to have you here. We always have fun conversations. Um, and let's kind of launch into it because there's a lot of stuff out there right now about leaky gut. What's leaky gut? What is it not? And maybe we should start there is just talking about what that means because there's good information and not so good information.
Yeah, I mean, leaky gut is just, I always think of it as just it's increased permeability. So the gut lining, like in the intestines, like where the mucous membranes are, all that, in people and cats and dogs, inside the intestine where the poop is and the food goes in, that's considered outside the body. So there's some the immune system wants to regulate how that's getting into the body, what it absorbs, what it doesn't absorb. And it likes to do that in an orderly fashion and see what's going on and see if they like things. But sometimes those cells that are lined up, is my example, I always use my hands. So the cells that line the intestine, they're a bunch of little cells and they're mostly the same height, not like my fingers, but so when they talk about the intestinal lining taking up a tennis court or something, it's because it has all these little things that go up and down. So there's the villi are made up of the little cells, and the cells are normally next to each other, and things can come in between them. They can come down the middle. And they're connected with things called tight junctions. So things hold the cells together and they'll like loosen and let them in. And in increased intestinal permeability, those tight junctions might be gone, or there's a lot of inflammation and swelling, and the cells start to kind of pull apart. And it may not be all of them, but I could do my Spock thing. But but that
Live long and
impairs.
prosper.
Yeah. So that impairs the ability of the immune system to really see what's coming in. Wait, I didn't mean to let that thing in, or I want this broken down more before I let it in like that. You might, have proteins come in that they're too big and the immune system, freaks out over them. So there's a lot of things going on in the gut, and you want to, keep it not inflamed and all orderly. So leaky gut is just that the cells aren't lined up nicely. And some of those little tight junctions, they're just little bands that hold the cells together, are gone. So that just means that you need to make some changes. So there's not necessarily like a disease state, like IBD or, some kind of diagnosis like that. You're not necessarily going to get, but it's associated with issues. So you might have a pet who has leaky gut. They might start to have food reactions because some of those foods are coming through that normally wouldn't make their way through. They, So food reactions, skin reactions. So zonulin in the human side, sometimes you can see those immune reactions to food are related to increased zonulin levels. So you,
So what's zonulin? That's the other
yeah.
big question.
Yeah, so zonulin is a protein that gets made, and it's like a lot of things. Like we use it for some stuff, and we need a little bit of it, but we don't need a lot of it, and it will pull those tight junctions apart. So you don't want high levels of zonulin. I think on the human side, and there's a lot of cross reaction. Like a lot of studies are started in pets and then it moves to the humans. But now a lot of things that we know in the human side, we're like, I bet that's the same in the pet side.
Right
So
on.
I have worked, for decades in integrative and functional medicine, just trying to pull out, like, is this true? Like, let's look and see. Let's do some research and see what's out there. And so when I moved to the pet side, that was because my dog Linda, she actually has passed. She died when she was 18. We like to say she went off to college. And she's away at college right now. But she had a lot of gut issues, and I worked in a functional lab doing, gut testing and helping people. So we helped a lot of people who would maybe go to a gastroenterologist and have bloating or diarrhea or cramping, and they'd get a colonoscopy and they'd say, well, you don't have colon cancer, IBD, bye. And they weren't
Looks
necessarily,
great.
yeah, this lab test looks great, so bye. And people are kind of left. So I think we see that a lot with the pet world too. Like if you're not diagnosed with some condition, it's like, I'm not sure what's causing it. So,
And that's kind of where it ends, right? Is the shoulder shrug. And
yeah,
then
I know.
meanwhile, you or your dog still have evil, awful, screaming diarrhea and no options.
Right.
So
So with
yeah,
zonulin, when it's elevated, it's telling me that, so when the zonulin's really high, I know it can pull off those tight junctions. So that's increased intestinal permeability. It is like a marker that's going to come up and down. So, but it's not going to shoot up and then come way down. So if it's high, it's going to be modulating, but it's on the high end. But there are things that we find effective. We find them effective in people and in pets. So if you test and you find the zonulin is elevated, you can, do things to help soothe the gut lining. There's
cool.
certain pet products that have, aloe or different things that can help heal the gut lining. And then changing
Right on.
foods, sometimes just changing proteins in a food can be helpful.
Right on. And that makes total sense. And so we can look at what's in the diet if we need to do maybe some food sensitivity testing to help kind of soothe things down. One of the things we love to use is slippery elm in the dog
Hmm.
world. I think less commonly, unless you're from the South, is okra. I mean, that's an awesome vegetable I miss, but okra can actually help calm things down along with aloe. So there's a myriad of options. But I think that so many of my conventional colleagues, they don't have the time to really go into this method to start to support dogs and cats with IBS or IBD, or like you said, they're somewhere on a continuum. They're starting with maybe one episode of diarrhea a month on a consistent basis, and then that progresses into something that somebody can slap a label on. So I think it's
Yeah, I mean, we have people who, you know, feed probably the cheapest dog food, just because that's what they can afford. And they're, to me, always people or pets, bad food's better than no food. I mean, you got to eat. And all the way up to people who get a lot of supplements and make their dogs own, their food. So there's a range. Not every dog has to have everything, but for a lot of people who are spending a lot of time and money on their pets, we get people who do our tests to see, like, is everything working? So everything, all my markers are good. So besides zonulin, we look at calprotectin and secretory IgA. All of those can kind of tell you everything's good. It's all quiet in the gut.
cool. Well, and let's talk about that a little bit more too, because I think what happened on in the human world, these are markers that have been used first in functional medicine, now in conventional medicine on a regular basis to really figure out, okay, what's going on with the gut. So let's talk about calprotectin a little bit first.
Okay, yeah. I mean, it's one of my favorite markers.
It, yeah.
Um, you know you're a nerd when you got your favorite marker. Um, yeah, calprotectin, it's, we look at it in stool. You can look at it in blood, but stool has been found to be, a little more representative of what's going on in the gut. So in our test kits, you get a little stool sample, have a little spork on there. And so all our tests are stool tests. And so with calprotectin, it is identifying, when you see that, it's identifying neutrophil infiltration into the intestines. Neutrophils are white blood cells. So it's just saying there are white blood cells here. And along with that, you're going to get redness and inflammation, swelling, those kind of things. The fecal calprotectant, they've done this in people and pets where they've looked at the fecal level of calprotectant. And as it goes up, they've also looked at biopsies within the intestines and done scopes. So they know that higher levels of fecal calprotectant directly correlates with inflammation in the gut. In the human world, one of its things that it's best known for is helping to differentiate inflammatory bowel disease, so like Crohn's, colitis, like those kind of things, from IBS, like in irritable bowel syndrome, which it has its own diagnosis, but it's not, inflammatory. It's, different symptoms. So if calprotectin is low, it's unlikely to be an inflammatory disease like IBD. It's more likely to be an IBS type condition. So if it's low, it's really saying there's no inflammation. There may be lots of other things going on, but it's not inflammatory. So,
Right on. So that's where we might see like inflammatory, and in veterinary medicine, it's kind of a little sad. I think the difference between IBS and IBD is the number of medications the pet is on. But this is a situation where zonulin may be elevated with IBS, but calprotectin is the one that you're looking for something that's advancing further. Is that a
right.
fair statement?
That's a fair
Okay.
statement. Yeah. And when the research, more conventional research, when they look at calprotectant, they have it in 3 stages. Like, you could be food responsive. Your pet could respond to just changing food. They could be antibiotic responsive, where you just give them some antibiotics and that'll take care of it. Or they could be, like immune modulating medication. So something a little stronger. So I'm not arguing that those things may be true. It's just like, but we're over here and we're expanding that food thing. Like food could make a big difference. And instead of antibiotics, why not modulate the gut bacteria they have? Feed the
Right on.
good bacteria, maybe some probiotics. I'm a big fan of prebiotics. And then a lot of gut calming herbs. And, you can use certain teas. Give your dogs blueberries. I think one of the reasons my dog Linda lived to be 18 was like she loved fruits and vegetables. So
Right
she
on.
was like, oh, always, even when I wasn't thinking about what I was feeding her and just grabbing some dog food, she got a good percentage of her diet, like blueberries or some pumpkin, just whatever, red peppers. She just ate anything like that. And I think that helped her because it's anti-inflammatory.
Well, and honestly too, I mean, the deal is for years we've been hearing on the human side to eat the rainbow. And so the rainbow are polyphenols. The
Mhm.
polyphenols aren't for us, they're for the gut bugs. And when you eat that wide variety of colors, then the polyphenols are what help the good guys stay in charge and do all the amazing things they can do to help modulate inflammation, improve the neurotransmitter production, improve overall immune function, all of those good things. So I think you're absolutely right. And in fact, study after study after study shows that dogs that are eating some level of vegetables and fruits in their diets have much healthier guts. So right on.
Yeah.
Good, good for
Yeah, and
Linda.
I think that, like, there are tests out there where you can look at the microbiome, and we did that in the human world. So, it's a group of women mostly who started our company, and we had done that in the human world. But what we found was these functional markers that identified, is there leaky gut? Do you have inflammation? What's the immune response? Those things were more actionable than getting a pattern of gut bacteria. So it's very interesting. And sometimes if it's extreme, it can tell you things, but those, like, there may be a pattern associated with like in level of inflammation. And to us, it was like, well, why don't we just check inflammation directly? So I think
Right
that's
on.
one of our things. People always think that we're doing microbiome testing and we're doing like more actionable functional stuff.
Right. And the other thing is too is that later microbiome testing may be really important, but I think what happens when that first came out is people would go do that and then do the fecal transplant but material. But the problem is that if the gut's not prepared to receive those new bugs, ultimately they just go right through the intestinal tract. So I think this is where what you're doing with the tests you've developed is so critical because you can actually get 75 to 100% of the issues resolved just with the information and knowing what you need to do next. And it may make it so that it's not necessary for microbiome testing.
Yeah,
So I
I
think
think
that's
that,
really,
yeah, they're going to have more information. There was just a Nature article that came out, which is really a top shelf journal, talking
yes,
about, that when you give the fecal transplants, you kind of don't know what else is happening. You just know, like, oh, they got better and there's some change, but there's so many thousands of things going on. You don't know, like, more downstream impacts. And the same with, there's other studies where they've done, well, people who go on antibiotics, if they take high dose probiotics after that, it takes longer for their gut
right,
bacteria to get back to baseline because probiotics, they're not going to take up residence. They're just there till doing some stuff and they're not necessarily doing bad stuff, but they could be knocking out the bacteria that live there. So, and they'll
right on.
eventually, fade. So we always think a lot about prebiotics, which I think polyphenols do act as a prebiotic, which means it feeds the bacteria you have. So
Right on.
polyphenols and fibers.
Yeah, and that's it, right? Because most of us are like, "Oh, my," and I said this for years, "Oh, your dog's going on antibiotics. We need to put it on probiotics as well." And there are certain probiotic formulas that can support preventing the microbiome from getting damaged, but I think you're right. That study showed that you actually have a much longer, um, recovery time, for the microbiome post antibiotic. And then, interestingly, for animals that have been really critically ill or on immunosuppressive drugs, probiotics can actually be contraindicated because they can create infections in the body that because of this intestinal permeability. So I think that's really something we need to be aware of.
Yeah. I mean, anything that I always think of, it's like start low, go slow.
Right on. Right on. Cool. All right. So we talked about zonulin. We talked about calprotectant. Now, what about IgA? Because this is really cool, and I got to grab my dog before she tries to jump off
Yeah,
the bed.
I closed my
Yeah.
door, so I'm fostering a dog right now. The animal
Oh, good.
shelter in my county they had to shut down half the shelter, um, so I went and got a dog.
Good for you.
But, yeah, so secretory IgA. So IgA means immunoglobulin. So there's IgA, there's IgG, IgE, IgM, there's a lot of immunoglobulins, and they do all sorts of things for your immune system. IgE is the one that's specific for true allergies. IgG tends to be more food sensitivities. But IgA is secretory IgA is the one that's going to live and kind of right below the gut lining and it gets secreted out and it does all sorts of things. So it's SIGA. It's the first line of defense at the gut lining. So it kind of sits down there and it comes through. And actually, one of the things it does is it comes out and it wraps around all the commensal or good bacteria. So generally, you're going to see fecal IgA kind of rise and fall with good commensal bacteria. So that's one of the things that it does under normal circumstances. It will significantly increase when it has to fight a parasite or a pathogen. It also, increases with food reactions or viruses. So if it's got something to fight, it will jump up. But we also know that just like in people, in pets, if you've been fighting something for a long time, the IgA goes down, especially if you have, additional inflammation or increased permeability. It's hard for the IgA. I mean, it's a protein. You just keep making this protein, which you need a lot of resources to do. And, so it can be an issue. So when we see it really high, we want to just support, maybe look for what's causing that. And then when it's really low, we want to, help support it overall. I think Saccharomyces boulardii is probably one of the first things that we think of. There are other things like colostrums and stuff that can help support it overall. And what I generally see in pets is that IgA may start to go low first. That may be the first thing you're going to see before you see calprotectant. So, I mean, this is all kind of giving me a story of what's going on at that, gut lining. So, I think it's a great way to look at it. In our tests, we have a test that looks at secretory IgA along with calprotectant. We also have another test that just does, calprotectant and zonulin. And it's a pretty interesting protein. There's people tend to have two types of IgA, and then that's IgA2 is in the gut, IgA1's in the blood. Dogs have one type of IgA. Rabbits, I had read in some paper, have 11. So I don't know
Wow.
what they're doing with all that.
Wow.
Yeah, I don't know. Yeah. But so I think that we're just looking at that within the stool to see what's going on at the gut lining. What do we need to do? What do we need to do to help support things?
Right on. Well, and so, to that point, Anita's asking if probiotics can help with gingival hyperplasia. And that's a situation of, something is not right in the oral microbiome. And that's a really profound situation with overabundant inflammation creating a lot of extra tissue in the gums. And so, Anita, what I would say to you is that thinking about like a supplement or a thing or this or that, the other is going to yield you probably what you've got already, which is not much change. And so that's where doing one of these tests, because if there's massive inflammation in the mouth, that means that likely it started because there's massive inflammation in the gut. And so if you can figure out how to get the gut under control, then there's some other things that you can do to support that gingival hyperplasia as well. But that's the thing. I mean, you're trying all this stuff. It's really tough without a guide. And that's where I'm going to drop you a link to our holistic pet health coaches. And that's where these folks can really help you um, start to cut through all of the issues that are out there. And one of the other things you can do is check out the tests, and then I'm going to drop a link for you with a beautiful code in there um, that will get you 15% off the test itself. Oops, if I can do this.
I think you can.
I think I can. It's Hio.
It's pressing a lot
She's
of buttons.
restricting me. Right on. It's pressing. She's helping. So go check out Innovative Pet Lab. And then, for this situation where we've got really body-wide systemic inflammation, this is probably where that combination test, looking at all three of these markers, would be super useful. Do you think
Yeah,
that's
so our tests look at pairs. So if you're going to pick one, um, test that looks at a pair, you might want to pick the basic gut check because it's going to look at zonulin and calprotectin. I mean, we have them in pairs, like, so inflammation and immunity, that's going to be IgA and calprotectin. But the basic gut check is going to be the zonulin and calprotectin. I'd probably start there. We also have I don't know if you can, there's light coming
There it is.
Yeah, we also have the comprehensive, and it's for dogs. It's got all 6 of our tests, and for cats, it's got 4. And that's also going to look at elastase, fecal elastase, which kind of assesses the pancreatic function, how good is digestion. It looks at beta glucuronidase and just response to gluten, anti-gliadin. So all those together even give a bigger picture.
Now, what's beta glucuronidase?
Yeah,
Let's talk about that for
I
a
like
moment.
that
Since you trotted out that big fat word.
So beta glucuronidase, it's an enzyme, like, mammals make it. We make it, dogs make it, cats make it. So you just need a little bit, but also gut bacteria make it. So if you see it in the intestine, in a stool test, and it's really high, it's identifying that there's probably a lot of bacteria in the gut making beta glucuronidase. So when I see it really high, that's the time I might think, oh, maybe I would do a microbiome test. But really, I'm going to start looking at balancing the bacteria. I'm going to look and see, is there inflammation or other things? Maybe giving some prebiotics and like those polyphenols and things to kind of help with that. The other thing that beta glucuronidase does, like if that's all it did, at least it would let you know that there's dysbiosis. And dysbiosis is when, the bacteria in the gut is imbalance. So like the biosis is dist. So it's imbalanced. So that's pretty good information. But the other thing that beta glucuronidase does is it likes to interfere with detoxification. So there's a process that, all mammals have, that glucuronidation, where we take toxins and we put them through glucuronidation, which puts a specific glucuronide molecule on it, like a toxin or a hormone, and then you excrete it out. So that's what's happening. Toxins, hormones, they can get sent out, all different pathways, but they can get sent out in the stool. To get excreted. But if there's high levels of beta glucuronidase, it as an enzyme's like, ooh, I want that glucuronide molecule, and it'll grab it because it wants it. But then the toxin or the hormone doesn't end up getting excreted. It's just kind of loose in the intestine, and it can get reabsorbed. And then so it concentrates toxins or hormones. So when that's elevated, I also want to make sure, like, I'm pretty diligent about avoiding like toxins, in their foods, running on lawns, those kind of things that can increase toxin levels, and maybe thinking about a milk thistle or some kind of antioxidant type of, well, not antioxidant, detoxification type support.
Right on, right on. And I think that's something that we don't think about on a regular basis enough. And we've started using a fulvic acid, humic acid product, and also TUDCA, which is an interesting compound to help push garbage out of the liver. And then if you've got something to absorb it, then you can actually get it out of the body. But I think we're all overloaded with toxins, just from living, from breathing, drinking water, eating, walking around. And that's really going to be a critical part of staying healthy, is sort of a daily detoxification. But if your gut's not working well, that's going to amplify that problem.
Right. I mean,
So
I think that's also one of the benefits of like fiber. It can bind things. It kind of helps
yeah,
support, gut bacteria, and then, it can bind things on its way out. And it helps move things through so they're not sticking around. I think that's one of the things with some of those. If you go too fast, then nutrients don't get absorbed. If you're too slow, then maybe you can, absorb more than you want, or toxins can increase.
Right. Yeah. And I think that's a real critical issue. A lot of folks deal with constipation issues for their pets, and that's when, yeah, the nutrients get absorbed, but it's uncomfortable. And as you just said, more toxin reabsorption from the body.
Right.
So this is pretty interesting. So Maria had actually gotten the comprehensive gut check and her for her kitty, and her cat had slightly elevated zonulin and high IgA, and she's been having some skin issues. So, and then high eosinophil. So we're really marching strongly into that allergy um, category. So you guys suggested some gut soothe from Adored Beast, and that's great because that will help to kind of cool the gut down. But Maria, what I would like to suggest to you as well is that probably there's some food sensitivity issues going on in there. And that's where one of our other partners, Glacier Peaks, has a very nice at-home wellness life stress scan where you can just send in a small amount of hair, organic cotton swab with some saliva, and get information on potential food sensitivity so that you can adjust your kitty's diet. But I think that would help. I mean, it's important to heal and seal the gut, but also to take out the things that could be creating issues.
Yeah, I mean, you do see IgA go up with food reactions. You see zonulin go up. It goes up with reaction to gluten, but also it goes up to imbalance in certain bacteria can cause it. In people like intestinal permeability, you'll see in with smoking, NSAIDs, alcohol. I mean, so if pets are in a house with secondhand smoke, that could be a problem. Any type of NSAIDs for pets. And then eosinophils, yeah, that makes me immediately think about food allergies.
Right on, right on.
Yeah.
So yeah, so that's all good stuff there. And that's interesting. So secondhand smoke, how about all of these diffusers
Oh, yeah.
with yeah, so the
I'm not
indoor air pollution causing stuff. I mean, are you aware of any studies about that kind of stuff or
I'm not aware of any specific studies. I think, those compounds can phthalates or different things can, cause issues. They're endocrine disruptors, so I would try to stay away from them for my own family, my pets. I don't think anybody should be getting those artificial smells. It always bugs me
no?
when like they have the commercials like, "Oh, and I smell great. I used whatever plus I put the beads in." Like all those odors are essentially kind of on the piggyback of of toxins and things that you are absorbing. So I think that I would I would be cautious of those kind of things.
Right on.
So
And the other thing too to remember is that our dogs and cats actually have somewhere between a 3x minimum to up to 93 times our toxic burden, depending on which specific compound we're looking at. And cats tend to be on that higher end because they're breathing in dust, they're walking through it, they're licking their paws, they're grooming themselves, they're low to the ground where all this stuff settles. So that's where I think it's really critical to start looking at, okay, what cleaning products am I using? Am I diffusing out all this stuff that could be adding to my cat's toxic burden? And in my home, is it so airtight that there's no air exchange? And that's where using HEPA filter. Actually, Rodney Habib and Dr. Karen Becker had a great hack in their Forever Dog Life book, which is just taking a couple of air filters and putting them on a box fan, and that was evidently as effective as some of these
oh
really
wow.
expensive HEPA filters. So there's a cheap hack. You just need duct tape, which is what fixes everything.
Oh, I'm in the South,
And
so that's all over.
exactly, so, so baling twine and duct tape, you can fix everything in the world. But that's a great idea, especially for your kitty that's got some stuff going on and some markers of inflammation and possible allergic irritation. So I
Yeah,
hope
and I
that's
think all
helpful.
those things like taking your shoes off before you come in, like all those things really do add up.
Yeah, absolutely. So, all right, let's say somebody like Maria's gotten some information. Okay, I've gotten, I see that my kitty's zonulin is elevated and IgA is elevated, and I'm going to make a few interventions. So she's trying some gut soothe, maybe looking at some diet changes. Then, if how should she figure out, okay, do I need to retest for this? Some of it's going to be obvious because hopefully what Maria will see is that the itchies and the scabs start going away. But how would you continue to use your test to see, are things getting better? Are they staying the same?
Yeah, I mean, we would do, we recommend follow-up in 3 to 6 months. I mean, for pets that have a lot of symptoms that, there's a lot going wrong, it may take a while. It may take a couple of tests to see, maybe every 3 months you kind of see, is this working? It's not it's not like generally like an antibiotic. I took this and in 2 weeks it's going to be gone. So it's really kind of tweaking, like, okay, we're going to make these diet changes. We're going to offer, get some gut soothe, make certain diet changes and kind of keep track of those diet changes to see which ones made a difference. Certainly in a pet that, just getting a health check, it's fine. We, generally think about getting it once a year. In a pet that does it, they have some issues, they do some treatment. If they suddenly don't have any more symptoms and you're all good to go, a lot of pet owners may just like, that's it, we're good to go. But some may want to see, like, did that solve it all the way down to the cellular level?
Right on.
So,
And I think that's really important because we see the symptoms go away and we throw a party, and rightly so. But I think it's critical to make sure that everything really is reset back to normal because what I've seen happen in the past is things are great and then they're not so great. And we want to prevent those relapses or recurrences from happening. So retesting is a way to make sure that you really do have the problem completely solved.
right.
And if you don't, then you've got more wiggle room for making some other adjustments to help that process happen.
Yeah, and I think in dogs with more severe things like an IBD, I would probably check, at least every 6 months to make sure that inflammation, because you may not know that inflammation's creeping up until they start to have symptoms. And especially in a dog who is already known to have, inflammatory bowel disease, you want to catch that early.
Right on, because there is nothing, I mean, relapses are just not fun. And I think this is what tends to happen, especially on the human side. We get our symptomatology better and we're like, great, let's go back to
Yeah,
what we were doing before. And then in about 3 months, it all crashes and burns again. And I think for a lot of pet parents, that happens as well. They're like, wonderful, everything is better. But oh, dang it, a month later, things are starting to go sideways again.
right. Yeah. So it
Mm.
does kind of let you know what's at the cellular level. And,
Yeah, and have you really gotten all of the components of inflammation uh, and really this is going to give you an idea if the microbiome has re-regulated itself, if none of these are parameters are out of the normal range in terms of zonulin, secretory IgA, related glucuronidase, the whole 9 yards.
right.
I think
Yeah, and like I said, it's like a lot of people will do it just to see, like, I think I'm doing everything well. I think my pet, I spend a lot of time and money on my pet, so just kind of check in. Like people check in, you get a panel at the doctor's office just to make sure everything's okay.
right on, and that's it. I think that we've been in this culture of sick care for a long time, and a lot of folks are getting the idea that true preventive medicine is a boon in terms of preventing suffering further disease. So, so if you've got that concept in your mind, this is a test that will really help your pet stay healthy, and I think that's really awesome. Because this does give you more information and more power on what you can do.
Yeah, and our
Cool.
results will say like possible diet changes, possible supplements, possible lifestyle changes, because we hadn't really mentioned that. But we do find Like secretory IgA is kind of closely related to that whole cortisol, circadian rhythm. You know, people do better and pets do better when you know what's happening. You know,
Right
the
on.
whole sleep-wake cycle, like when they go out and go to the bathroom, when they, go to bed, they just everybody does that. I always use coffee as the example. Like people drink coffee every morning, they skip it one morning and they get a headache, and you get a headache because your body's gone ahead and secreted those enzymes that are going to dilate your blood vessels. Because every morning you drink coffee, your body secretes enzymes and it kind of, constricts, it dilates those because the coffee constricts it. So it's just doing the
Right on.
opposite effect to kind of keep the blood vessels the same. And then when you don't drink it, you get the impact of it because the body's gone ahead and done it because they know you're going to drink coffee. They didn't know if you did or you didn't. They just, you drink it every morning. So I'm going to go ahead and secrete it. And that's like a lot of enzymes and a lot of thing that goes on in the body. Bodies like what they know what's happening. They go ahead and get in a rhythm. And it's, the same with pets too. Their bodies get in a rhythm.
Right on. Exactly. And that's it. I mean, we like rhythm and we like sameness just because there's less energy spent in the body predicting what might happen instead of saying, well, this is what usually happens, so we're just going to go with it until something changes.
Right.
Cool. Right on. Well, I think did we cover all the interesting stuff and talk about well, actually, I think the one thing we didn't talk about, well, we did a little bit, is about deciding when you might use these tests. And I think early on we said, if you're starting to see a pattern develop, like once a month, my dog has diarrhea, this is a good time to use one of these tests to get this information so you can make generally at this point nutritional or possibly supplement interventions instead of having to go to the vet and get the antibiotics and all that stuff and wait for it to get worse. So anything we missed on that one?
Yeah, no, I think that makes sense. Get things early. I mean, we use it as, our own pets, like health check, just part of their yearly stuff, just to make sure, especially as pets get older. We might want to see if things are going to kind of sneak up on them. But yeah, I think that if you're seeing any symptoms, signs that the getting in there early, because there are so many things that it can be. It can be related to lifestyle. It can be related to diet. It can be something cellular. So you want to get and like be able to say, okay, it's not this, might be this. So you can kind of move forward. But we do, yeah, we do our tests a lot. Our own dogs were constantly like checking things. I might at one point when we first started the company, I did my dog Ollie every day, morning and night for 10 days straight to see like what's the consistency in there. Am I going to see a big change? And the only one that moved a little bit from like normal to borderline was the secretory IgA. And that makes sense because that one, it is the first line of defense. So it's going to be ready to kind of be on guard. And the other ones, like once the calprotectant comes up, that's going to mean there is a lot of inflammation.
Right on. Right on. I think that's super, super critical. So amazing. All right. So one more time, y'all, here's a link to Innovative Pet Lab's website. You can drop in Dr. Ruth for 15% off the test. Let's see. Cool. Raman's asking, sorry, this just popped up, and I think that's a great question. Test it using a test as a baseline with a pup when they're about a year old or when they've matured.
Yeah, I mean, I wouldn't do it in a really young puppy. I would wait till they're at least, 9 months, probably a year. There's just not a lot of research. We are currently like doing a lot of puppies to see like what's that change in people. You'll see, babies have bizarre sometimes results. Like newborns often have calprotectant super high when they're first born. They also often have a lot of opportunistic bacteria that if we had it would be, a problem, but they somehow have that in their stool and they work it out. So same with, young puppies. And so we tend to say like, why don't you wait till they're, at least 9 months?
Right, because they're going through so much in terms of trying to get their immune system online, get past what mom passed them down, and develop their own immune system. And if they came out of a situation where they were weaned early, or they were, in a really filthy environment, or had coccidia or any of these other things, that's going to alter all of the parameters in there.
Right. I mean, you
So
could test earlier, you just need to realize that some of those could change. You could still treat with anti-inflammatories or provide, some colostrum in a weaned dog, puppy.
right on.
So,
Yeah, kind of help things go right.
mhm.
Cool. Well, Doc, this has been fun. Um, I cannot thank you enough. I think what you're doing with these tests is amazing, and giving pet parents so much information, and the fact that they don't have to go to a vet, they just have to send in a poop sample, makes this so much easier to actually carry off. So thanks for
Yeah,
your times. Always happy to have you.
no
Um,
problem. It was
and
fun. Yeah. And I will say our
right
tests,
on.
when you mail them, they can go right from your mailbox. So you don't have to go to the to someplace else to mail it. So when we developed the test, we could never get to the mail. So we're like, it has to go out of our mailbox. Nobody has
Right on.
time.
Nobody has time to go down to UPS or something. Right on.
Right,
Cool.
right. So
All
yeah,
right,
no, it's
y'all.
been great.
It has been so much fun. All right. Well, y'all take good care. We will see you next week. Until then, hug your pups and kiss your kitties, and we'll see you soon.